So, ayan guys, good day. So, since this is asynchronous class, so you can watch this video again and again, ganyan, paulit-ulit, di ba? Ulit-ulitin nyo lang. Since di ako magbibigay ng, dito lang sa mga part na to, di ako magbibigay ng, tawag dito, handouts kasi nga, para manood po lahat, hindi yung nagbabase lang sa ibang tao, ganyan. So, ayan, hindi ko na po papatagalin. So, we have postpartum, di ba? We have prenatal, di ba? Prepartum or prenatal, sabi nila. Intrapartum during the delivery and postpartum after the delivery. So, there are lots of postpartum complications. One of them is postpartum bleeding or may tinatawag po tayong postpartum hemorrhage. So, sabi dyan, every drop of blood is vital. Di ba? Napakahalaga po ng blood sa ating body. Hindi lang dahil sa mga buntis, sa lahat po ng uri ng living things, kailangan po ng dugo. Okay. So, postpartum bleeding, any blood loss from the uterus greater than 500 ml within a 24-hour period. So, pag nasa delivery room kayo guys, di ba, hindi naman nasusukat minsan yung blood. Basis po ng mga doctors or nurses is yung diaper ni mother. Kung nasok po sa blood. Kung mabigat po siya, kinikilo po. Di ba? Kikiluhin mo na yung diaper, kung anong kilo, and then i-add na nila yung kung ilan ng blood loss, di ba? Kasali bang ihi dun? Tanungin din natin syempre, tapos i-convert natin yung kilograms to ml, di ba? So, within 24 hours, dapat hindi po nagba-blood loss si patient, di ba? Greater than 500 ml. So, in early, first 24 hours, then late, anytime after the first 24 hours, di ba? After 24 hours, ibig sabihin niya. And then, what is the leading cause of maternal mortality? We have postpartum bleeding or postpartum hemorrhage. So, ano bang cause kung bakit nagbe-bleed si mother? So, don't forget this mnemonics, di ba? ULDR. Diba? ULDR means, U means uterine atony, and then L means lacerations. Okay? Uterine atony, guys, means naka-relax ang kanyang uterus, hindi po nag-contract. Diba? Supposed to be, pag lumabas na yung placenta, nag-start na nagpo-contract si uterus. Pero dito, nagkaroon ng uterine atony, kaya bleed lang ng bleed si mother. Pwede din isa sa cause is lacerations, diba? Kung ilang, lalo na pag naka 4th degree na yung hiwa ni mother, diba? Yung episiotomy, umabot hanggang rectum. Grabe na po yun. And then D, we have disseminated intravascular coagulation, hindi nag-clot agad yung blood. Diba? Kahit binigyan na po siya ng metergine, ayan, oxytocin, hindi agad nag-clot. Then, retained placental fragments. May natira pa pong pira-piraso, di ba? Placenta, we have shells and dankan, di ba? May natira pa pong mga particles po o fragments sa loob ng ni mother, uterus. Hindi po nalinisan na mabuti, kaya nagkakaroon ng postpartum bleeding. So, in early signs of postpartum hemorrhage, first 24 hours, there's a boggy or relaxed uterus and profuse bleeding. So, yan yung tinatawag natin uterine atony. Naka-relax si uterus. Diba? Hindi nag-contract. So, supposed to be, diba, is normal, is ayan. Di ba kaya kinakapa ng doktor or ng nurse or midwife yung, ano tawag yun dito, guys? Matres. Diba? Kinakapa. Uy, malambot diba? So, kailangan magbigay tayo ng ganito. Supposed to be ganito itsura, matigas. Pero nangyayari, lumambot, nagkaroon ng uterine atony, kaya bleed lang ng bleed si mother. Okay? So, that's the first 24 hours, we call it uterine atony. So, what are the management? Massage the uterus. Or, ayan, di ba? Lilinisin. Kaya sabi ko sa mga nagugulat sa mga estudyante sa akin, sabi ko, guys, usually pumapasok hanggang dito ang kamay. Kasi nga nililinis yan. Para tayo nag-DDNC, di ba? Nililinis ang loob ni mother. So usually, minamassage or guys, may tinatawag tayong nipple stimulation. Pinapalaro natin ang nipples ni mother. Kasi may nagre-release siya ng oxytocin para mag-contract ang uterus. Okay? Yan, modified Trendelenburg, di ba? Ano yan? Position po yan, guys. Ayan. So, ganyang position, guys. Itataas lang yung paa. Okay? Usually, hindi lang ito for bleeding. Pwede din po ito pampataas ng BP, lalo na pag mababa ang kanyang BP. And then yan, IV fast drip. Yung IV dapat yung intravenous mo may halong oxytocin, guys. Hindi lang po fast drip kasi para papalitan lang yung kanyang na blood loss. Kailangan din natin ng oxytocin para mag-contract ang kanyang uterus. Ayan. Ayan, sabi ko guys, nipple stimulation or pwedeng breastfeeding. Early breastfeeding once na lumabas si baby. Kasi yung posterior pituitary gland will release oxytocin, di ba? It is a hormone. So, normally, pag nag-release na oxytocin, magpo-contract ang uterus ni mother. Okay? It's either papalaro yung nipple or ipa-breastfeed sa bata. Okay? What if, ma'am, kung, alam ko, tatanungin yan eh. What if, ma'am, namatay si baby? Kailangan, ang advice ng doctor is nipple stimulation, pero hindi kinaya ng nipple stimulation. May lumalabas na gatas sa kanyang dede, then let the partner, let the husband suck that nipple. Okay? No malicious thinking, guys. Part po talaga yan ng maternal. Wala pong mali siya. Ina-advise po minsan ng doktor yan kung wala na po talagang choice. Pinapa-stimulate sa ng father. Father or it's either husband or partner, guys, or live-in partner. Okay? No malicious thinking. Lahat po to ay related sa ating study. Okay, sa early postpartum hemorrhage, ayan, pwede din laceration, guys. Lalo na pag mahabang hiwa. Tapos, upon doing the episiotomy, may mga fragments or area na hindi natahi ng maayos. Pwedeng mag-bleed po dun. Diba? Well-contracted uterus plus bleeding, pwedeng laceration, diba? So, kailangan i-assess natin bago pagkatapos i-repair ni doc ang hiwa ni mother, i-check natin kung may mga signs of bleeding pa. Okay, yan. Cervical. Kasi hindi lang po sa outer part, di ba? Hindi lang sa may vaginal wall ang hiwa niyan. Meron din sa loob siguro, nagkaroon ng laceration sa loob. Pwede po yan, guys, lalo na pag malaki ang bata. Okay? And then we have, ayan. So, ayan, guys. Ito, pwedeng magkaroon ng laceration dito part. Pwede din dito. Ayan, internal yan, guys, ha? Before the vaginal wall. And then, pwede din po dito magkaroon ng laceration. Lahat po ng tinuro, pwede magkaroon ng lacerations. Kaya, nagdo-double check ang doktor. Di ba minsan, nagsasabi nila, maglagay tayo ng vaginal pack. Di ba? Para mag-clutch yung area na yan. Okay? And then, what are the classifications of perineal laceration? Ayan, we have 4th degree, di ba? First, second, third, and 4th degree. So, pag sinabi natin first, we have vaginal. Review lang to, guys, di ba, sa episiotomy. Pag first, we have the vaginal wall or the vaginal skin and mucous membrane. The second one, we have first degree plus the muscles of vagina. And the third is, we have the second degree plus the external sphincter of the rectum before nung paglabasan ng pupo, di ba, sa may anus. And then, in a 4th degree, combination of 3rd degree plus the mucous membrane of the rectum. Literal na nasa butas na po ng rectum, okay, sa anus. So, that's the 4th degree. Yan yung pinakamalala. Okay? So, what are the management? Siyempre, episiotomy. So, ayan, inulit-ulit lang, uterine atomy. So yan, early postpartum hemorrhage or bleeding disseminated intravascular coagulation. Ano po yan? DIC, okay? Disseminated intravascular coagulation. It is a deficiency in clotting ability caused by vascular injury. So, yan yung hindi agad nag-clot. Kaya may chance na nagbibigay tayo sa mga nahawakan ko, guys. So, DR, di ba nabanggit ko yung tranexamic acid, guys. It's either nagbibigay ng tranexamic acid, kung hindi kayang tranexamic acid, hindi kayang stop yung bleeding, usually ang management po ng doctor is blood transfusion or BP. Okay? May mga cases po kasi na ganito, hindi agad nagka-clot yung area na may laceration. So, ang management is pag bumababa ang hemoglobin ni patient, nag-BBT po tayo, blood transfusion. Okay, and then lastly, we have the retained placental fragments. Ano yung mga retained placental fragments? Usually, di ba, may natitira pong, kaya chine-check pag lumabas ang placenta, chine-check kung buo ba yun. Kasi pag hindi buo, lilinisin po ang loob ni mother. Okay? Kasi pag may natira po dyan, usually nagkakaroon ng infection, pwede magkaroon ng sub-involution. Okay? So ito, let's move on sa dyan. So retained fragments are left inside the uterus. Leads to sub-involution, incomplete return of the uterus to its pre-pregnant size and shape. Hindi po babalik sa normal shape po. Or the, ano yun? Parang virgin style ulit. Virgin size and shape. Okay, so kailangan linisin po natin kasi pag di nalinis yan, pwede mag-lead into infection. So what are the management? Di ba? From the word DIC, the management is DNC or manual extraction of fragments or massaging of uterus. Okay? DNC except placental increta and percreta. Depende po kasi kung saan pinaperform yung DNC. Okay, pag sinabi kasi natin guys, accreta, attached placenta to myometrium. Pag sinabi natin increta, deeper attachment of placenta to myometrium. Pero pag sinabi natin percreta, invasion of placenta to perimetrium. Okay, ibang procedure na to guys. So ang ginagawa lang sa mga DNC is ito, pag maglilinis po tayo sa loob. Okay, manual DNC or manual extraction of fragments and massaging of uterus. Kaya di ba, meron yung nakikita ng doktor, hinahawak, ito yung mons pubis, tapos gaganon ng doktor. Diba? So, yan yun guys. Yan yung DNC. Usually, papasok pa to para lang maganon lahat. Okay? And then, titignan kung may bleeding part. Diba? So, that's the DNC. So, what are the nursing management pagdating sa hemorrhage? Siyempre, upon assessment, we have excessive uterine bleeding during the first hour following delivery and during the postpartum period. Okay, after 1 hour, di ba? I-check natin kung may mga episodes of bleeding, di ba? And then, after 24 hours, kung blood loss greater than 500 ml, and then signs of hypovolemic shock, di ba? Saan natin nakikita yan? Dehydrated si patient, di ba? Tapos ano pa, hinang-hina siya. And then, sinecheck kasi natin yung diaper niya or the IFC, ano yun? IFC indwelling Foley catheter. And then, signs of bleeding from unrepaired laceration kung hindi maayos yung pagkatahi. And then, signs of bleeding from uterine atony. Diba? Kakapain po natin yung matres. Okay, matigas na po ba? Diba? Kung hindi po matigas, ay talagang may tendency mag-blood loss si patient. So, what are the signs of hypovolemic shock? Cold skin, cold sweating din. Diba? Nagpapawis ng malamig. Yan, anxiety. Diba? Natatakot kung ano yung pwedeng mangyari in the future. Decrease in the output of urine, diba? Bihira lang umihi dahil masakit ng kanyang tahi. Confusion, kasi nga blood loss eh. Hindi maganda yung daloy ng blood sa kanyang utak dahil nagbabawas siya kaya nagkakaroon ng confusion. And then feeling of weakness in general, di ba? Pagod na pagod siya. Maliban sa nanganak siya nagkaroon ng fatigue, iba pa yung feeling ng pagod niya. Okay? Paleness in skin, yan. Lantang-lanta yung pasyente after manganak. Rapidness in breathing, nagkakaroon ng increase RR or tachycardia kasi nga gustong i-exchange agad ng body yung blood na nawala sa kanya. Eh nagkakaroon ng tachycardia, di ba? Or tachycardia. Then falling unconsciousness, biglang nawawalan ng nahihimatay. Then moist skin and increased sweating, di ba? Ayan yung sinabi ko sa inyo, nanlalamig, nagpapawisang malamig. So, what are the nursing care in early stage? We have to monitor vital signs, check the fundus always, di ba? I-check lang hindi titigan, kakapain po yan. And then the lochia every hour, di ba? We have different colors of lochia, di ba? So, you have to review that, guys. And then monitor level of consciousness, keep the bladder empty, and then anticipate increased pitocin IV infusion. Or, di ba guys, sa public, we have oxytocin lang. So, ayan, administer of ergot prep, IN, then estimate blood loss by pad count. Usually, hindi kasi padding yung ginagamit kaya per N. And then monitor input and output of the patient. Then this is the late stage of blood loss or the postpartum hemorrhage. We have to anticipate hospitalization, type and cross-match blood. Kasi in case of emergency talaga mag-BBT kayo dito, blood transfusion, so kailangan early as possible, gawin na natin to. And then anticipate pitocin IV infusion or administration of ergot prep, IM, and then administer antibiotic. Depende po sa doktor yan, hindi po nurse ang nagde-decide. And then keep warm and be alert to any signs and symptoms of shock. Siyempre, DNC and prepare for surgery para i-check po kung ano talaga yung problema kung bakit nagkakaroon ng blood loss. So, what are the complications? Siyempre, nagkakaroon ng shock, injury to uterus. Yan, sabi ko sa inyo guys, infection, inversion, pero very rare lang. And then sub-involution, thrombophlebitis, and embolism. So, yun lang yung postpartum hemorrhage. So, we have, ano naman dito? The infection. Yan, postpartum infection. Yan, postpartal infection. Okay, guys. So, postpartal infection. So, we have 3 kinds of postpartal infection. Usually, marami pa po, pero ito yung very common. So, we have endometritis, urinary tract infection, and wound infection. Okay, so very common ang urinary and wound. How about the endometritis? So, let's move on. So, yan. Sepsis of sa puerta, puerperal sepsis, an infection of the reproductive organs that occurs within the first 6 weeks after childbirth. Affects 2 to 8% of postpartum women ang nagkakaroon ng infection. So criteria usually, iba, 37.6 and above usually consider as fever. So on any 2 successive days after the first 24 hours following delivery in the absence of any other apparent fever source. So, pathogenesis of postpartum infection almost always caused by bacteria, normally present in the genitalia. Yes, kasi doon naman lumalabas si baby, di ba? Minsan, may mga pasyente kasi may pamahiin na wag maligo. Yan, di ba? Ang dumi-dumi ng puwerta. Nagkaroon ng infection, di ba? Dati, sariwang isda lang. Ngayon, bulok na isda na yung amoy na ni mother. Diba? Then 70% of infections are caused by mixed aerobic and anaerobic organisms like group A, B, and D, streptococci, E. coli, gonorrhea vaginalis, bacteroid species. So infection tends to be more serious in women who have undergone C-section. So mas serious daw, unlike sa normal spontaneous delivery, mas malala sa C-section pag hindi naalagaan yung wound. Okay? So what are the risk factors sa mga naoperahan, sa mga na-CS? Okay? Prolonged labor, lalo na pag pumutok yung panubigan, pwede magkaroon ng infection. Then multiple pelvic examination. So kailangan may time talaga po guys ng paggawa ng ay pag pag-perform ng internal examination, IE guys. So may time lang po siya. Hindi lagi-lagi naglalagay ka ng kamay mo doon sa puwerta ni mother, di ba? Unethical. Tapos magkakaroon pa ng infection si mother dahil kaka-IE mo. And then, syempre, pag lower socio-economic status, ayun nga, hindi lang sa poor na poor, wala kang knowledge, tapos hindi mo naintindihan yung mga in-explain ng doktor, or yun nga, nasa kahirapan, pwede magkaroon ng risk yun para sa kanya pagbubuntis or panganganak din. Then, intrapartum fever or diagnosis of chorioamnionitis. Then, pwede din pala sa obesity, di ba? Lagot si Ma'am Char. So, we have this history of, syempre, yung madalas nagkakaroon ng UTI and STD. Okay. STD, di ba guys? Sexually transmitted disease. And then, internal fetal monitoring. Di ba? Lalo na yung mga vaginal ultrasound. Okay? So, what are the assessment and findings? We have fever, chills, tachycardia. Yan, same lang sa, di ba? Pag nagkaroon ng sepsis sa katawan mo, ito yung mga findings na na mararanasan, di ba? Changing the color, amount, odor, and then consistency of lochia. Then, painful and tender uterine fundus, delayed intrauterine involution, body malaise, anorexia, and headache. So, ito po yung mga findings na makikita po nagkaroon ng infection si mother. It's either anong klaseng infection ba yan. Diba? Then, burning sensation on urination or dysuria, di ba? Ano yun? Di ba ito yung feeling na sumakay ka sa mainit na upuan ng motor? Ganito yun guys. Yan yung burning sensation of urination. So, what are the evaluation of postpartum fever? Consider potential sources, the 5 W's. Ano yung 5 W's? Wind, di ba? The lungs. Water, urinary tract, walking, or the DVT, di ba? Then wound, cellulitis, womb, endometritis, also consider breast engorgement, and or mastitis and infection involving IV access sites. Okay, guys? Yan yung mga pwedeng evaluate po natin, guys. So, what are the prognosis? Improve with early detection and appropriate management. So, ano yung mga bagay na pwedeng pang-prevent? Diba? Prevention and early treatment of anemia in pregnancy, diba? Anemia, diba? So, iron supplements, ferrous sulfate, ano pa ba? Folic acid, diba? Yung tinakel nung reporting. Then, strict asepsis, laging malinis sa katawan. Health teaching, diba? The prevention of laceration. Usually, uncontrolled naman tong laceration eh. Kasi nga, hindi mo na maalam kung gaano kalaki yung punit mo, di ba? Makikita mo ba sinasalamin ng mother yan? Hindi. So, i-instruct lang natin kung paano linisin, paano yung care sa kanilang lacerations. And then, good management of the third stage. Okay? More on health teaching and health education. We have also here perineal cleanliness. Yes. Adequate treatment of dystocia and prone with antibiotics. And then hygiene and proper attire of personnel, okay? Hindi lang basta hugas, kailangan gumamit din tayo ng mga sabon. Ayan. For disinfection, di ba? So what are the management? Start with ordered antibiotics. Maintain bed rest. Pag sinabing bed rest, hindi yung bigla ka na lang nagbuhat ng mabigat. Bawal po yung it's a no-no sa mga bagong panganak. Diba? Sa mga nagbubuntis pa lang, binabawal ang buhat mabigat. What more na lang sa mga bagong nanganak, diba? So, bawal silang buhat. Kailangan bed rest lang sila. Kailangan focus nila is nandoon sa baby. Then, observe standard precautions and then monitor vital signs, most especially the intake and output, and then teach perineal hygiene, provide nutritious, high caloric, high protein, high iron diet. Since nagpapa-breastfeed si mother, mabilis po yan magutom. So, kailangan mga nutritious food yung ipapakain kay mother, gaya ng mga malunggay. Di ba dinengdeng? Maganda yun sa kanilang breast milk. Okay? Iron diet kasi nagbe-bleed pa yan. Di ba? Parang na silang nagme-mens that time. And then high protein para po ma-absorb ng body niya para magkaroon ng lakas-lakas naman dyan. Kaya may calorie pa dyan. So, eto nga guys. We have 3, di ba? Endometritis, UTI, and wound infection. So, endometritis is the infection of endometrial lining. So, saan ba nakukuha yun? Usually in chorioamnionitis and cesarean birth. So usually tubal, scarring, and interference with the future fertility. Okay? So dito nagmumula yung infection daw sa may endometrial lining. So usually ang nagkakaroon nito is yung may mga chorioamnionitis and cesarean birth. So nagkakaroon ng sugat sa may tubal and interference with the future fertility. So what are the causative agents? Microorganisms of the vaginal flora like E. coli, di ba? Hindi lang po sa tiyan yan nanggugulo. So may pukengkeng din pala. Di ba? Klebsiella, pneumoniae, and Proteus species like group A, Streptococci, postpartum day 1 or 2. Si E. coli, usually lumalabas day 3 and 4, and Chlamydia trachomatis, more than 7 days, lalo na pag hindi naghugas ng pukengkeng si Mother Earth. And the anaerobic gram-negative bacilli following by the CS. So, manifestation, magkakaroon ng fever 3rd or 4th day. Then, ayan, parang dengue yung dating, no? Sobrang taas ng kanyang lagnat. And then, tachycardia. Ayan, kung ano po yung sinabi ko kanina doon sa sepsis, di ba? Profuse foul-smelling lochia remains rubra longer. Diba? Naka-lochia rubra lang daw siya, hindi nag-change yung kulay. Then excess fundal tenderness. Then delayed involution. Lochia doesn't follow RSA, di ba? Then boggy and enlarged uterus. So what are the management? Di ba pag nagkaroon ng infection, usually si doc magsasabi na antibiotic agad-agad. And then syempre analgesic like paracetamol, ganyan. Then oxytoxic, yan, para contract ang kanyang uterus. And then increase fluid intake. Then bed rest with BRPs. Ano ulit yung BRPs guys? Diba? With bathroom privileges. Okay, and then assess pain and involution, sitting in fowlers and walking, and good perineal hygiene. Kaya nga mahalaga talaga pag naghugas si Mother Earth. So, endometritis kanina, ito naman is parametritis. Ano nang para? AKA pelvic cellulitis. Okay? Oh, cellulitis guys. So ano to? Infection of the pelvic connective tissue including blood vessels and lymphatics. So it is a result of an extension of infection from the endometrium, cervix, vagina, and perineum. So what are the signs and symptoms? Ayan, same lang ulit po. Paulit-ulit lang. The management, ayan, basta infection, antibiotic therapy talaga din, analgesic pag nilalagnat, and comfort measures. Measures sa kanyang flower sa vagina ni mother, di ba? Sponge bath, change perineal pad frequently. Hindi yung dahil walang laman, ano na, di ba? Usually guys, 2 hours po ang changing time po ng pad talaga. It's either meron or wala, you have to change. Kasi baka may Kumalabas lang na white means hindi nyo lang halata, di ba? So, that's the proper changing of pad. Then, next, we have the UTI. Very common. Hindi lang sa mga nanganganak, pero very common po to sa mga nanganganak. Lalo na ngayon, hindi nagpapaw-paw. Diba? Bacteria invasion of the kidneys or bladder. Lalo na yung mga konti ang iniinom na tubig. Mas inuuna ang tubig. Usually, common ang UTI. So, yan. Sabi dyan, nagkakaroon cystitis usually caused by E. coli, di ba? Very ano si E. coli. So, often appears 2 to 3 days after birth. Then, common during puerperium because of trauma to the bladder after delivery. Urinary retention and overdistension of the bladder due to anesthesia or catheterization, di ba? Lalo na yung mga naka-catheter, hindi naman nila na-feel na umiihi sila, tapos biglang tatanggalin, di ba? Hindi nila alam paano ulit umihi. Parang nag-change yung part nung kanilang ano yun, during, dati diba sa isang araw nakakaihig sila from 5 to 7 times, ganun ngayon. Parang nung natanggal catheter, parang 2 beses, ganun lang, or minsan lang. Kaya nagkakaroon ng urinary overdistension or retention. Okay? So what are the risk factors? Lalo na sa mga CS2. Kaya binabladder training natin sila, di ba? Kapag naka-catheter sila, nilalak natin para pag naiihi na sila, tatanggalin natin yung catheter at makakaihi sila. And then, yung mga nag-undergo ng forceps or vacuum delivery, tocolysis or tocolysis, induction of labor, maternal renal disease, preeclampsia, eclampsia, or previous UTI during pregnancy. Common kasi usually to sa mga prenatal check-up, nagkaka-UTI si mother kasi nga hindi minsan mas gusto nilang juice, ganyan. O bihira silang minom tubig, di ba? So, assessment findings, low-grade fever, suprapubic pain, flank pain, di ba? UTI, masakit yung ano ko, di ba? Nanganak na, masakit pa rin kanyang balakang, di ba? Hematuria, di ba? Konti-konti ang ihi ni patient, biglang may dugo pa, di ba? Pain or burning on urination, ayan. Urinary frequency, urgency of urination, di ba? Uncontrolled usually minsan. So what are the management since infection siya? Siyempre antibiotics. Usually 3 to 7. Ciprofloxacin, amoxicillin or norfloxacin. Guys, hindi kasi effective sa akin na amoxicillin kaya nagsisipro ako minsan pag nagka-UTI. Diba? Then provide warm baths and allow to void. Ito guys, antibiotics, doctor ha, hindi tayo nurses na gano'n. Pero usually ito kasi mga gamot na may encounter nga pag nagkaroon ng UTI ang pasyente. Pag narinig nyo ciprofloxacin, ang pasyente may UTI. Diba? So yun yung nasa isip natin. Pag amoxicillin kasi masyadong malawak eh. Kung ano yung pinagbigyan, masakit ba ang ngipin, diba? Pwede amoxicillin binibigay. Mababang klase ng antibiotics, amoxicillin. So, provide warm baths and allow to void in water to alleviate painful voiding. Diba? Warm guys, hindi po hot warm baths. And then force fluids, you may give 3 liters of fluid per day. Usually guys, hindi na po kasi nasusundan yung 8 glasses of water ang ginagawa. 2 to 3 liters of fluid per day. Yun na po yun. Okay, wala nang iba. So, 3,000 milliliters of fluid per day. Then, encourage measures to acidify urine. Acid ash diet. Okay? Wala pong soda. Bawal po sa mga acidic na pagkain. So, analgesics for pain, usually paracetamol, celecoxib, di ba? For pain reliever, tramadol, ketorolac. Okay? Then, regular emptying of the bladder. Okay? Pag naihi, hindi yung pipigilan mo pa. Okay? And then, provide client teaching and discharge planning concerning avoidance of tub baths, avoidance of bubble baths that might irritate urethra. Okay? Importance for women to wipe perineum from front to back. Diba? Alam nyo na rationale niya, guys. Bakit front to back? Diba? Then increase in foods or fluids that acidify urine. Bakit from front to back? Yeah, assignment ko na yan, guys. Okay? Di ba pag naglalagay din tayo ng catheter, bakit front to back? Hindi back to front. Okay? So, yan. Ano yung mga acid ash diet na sinasabi niyo, ma'am? mababa ang acid. So, decreases urine pH like fruits, cranberries. Di ba yung pinapainom natin na nasa, na nasa bottle, yung nabibili sa malls. Di ba yung cranberries, prawns, plums, meat, fish, cereals, whole, grains, cheese, eggs, poultry, pastries, corn, legumes, or mga alkaline ash diet. Di ba? Increases urine pH. Fruits except CPP milk, beef, and salmon. So, anong diet pag may UTI? Acid ash diet. So, ito po yung mga guys. Itong una sa una. So, lastly, we have wound infection. Most common site is the perineum. Lalo na yung mga na-episiotomy, di ba guys? And then CS, yung mga nabubuksan. So, what are the signs and symptoms? Fever, same lang, increased drainage. There is often foul smelling, malansa, mabaho, redness, mainit yung area, ecchymosis, and pain on the area. So, stress importance of frequent perineal hygiene and peripad changes. Makulit. So, what are the nursing assessment? We have REDA, REEDA, redness, edema, ecchymosis, discharge, and approximation of skin edges, kung gaano kalaki yung sugat or the laceration. The generalized fever, localized tissue worm. We have tenderness, masakit yung tahi na area. And ayan. Ito yung una. Pasintabi sa kumakain po. Ayan. Ito yung tahi, guys, sa CS to CS. Then, nasa CR si Kuya, bakit? Then, ito po guys, sa perineum. Diba? Very wak. Grabe naman to. Nawak-wak, bes. Laki ata naman ni baby. Diba? So, normal spontaneous delivery sa nasa right and then nasa left is CS. Diba? Nagnana na. So, yan yung maiiwasan kaya nagkakaroon ng wound infection. So, cause, ayan, most often the etiology organism associated with, ayan, basahin nyo na lang, guys. Usually sa NSTN, CS naman yan, guys, lalo na yung mga primary. Diba? So, perineal infections usually occur on the 3rd and 4th day after giving birth. So, common causes, infected lochia, diba? Endometritis, fecal contamination of the wound, poor hygiene, hindi nilinisan, di ba? After 1 week nung balik sa hospital, yun lang yung linis, Diyos ko Mariose. Yun yung mga mababa talaga yung pangunawa nila. Hindi nila agad naintindihan yung, kaya minsan gumagamit po tayo ng mga madaling terms para maintindihan ng tao. Okay? Meron kasi mga bantay na iba yung pagkakaunawa. Hindi naman natin sila masisisi. Kaya kailangan gumamit tayo ng mga mabababaw na words, yung madali nila maintindihan. Lalo na pag mga iba-iba po yung kanilang ethnic, di ba? Iba-iba yung salita nila. Kailangan marunong din tayo or meron tayong pakiusapan na magsabi sa kanila. Then, causative agents, microorganisms of the vaginal flora. So, abdominal wound infection usually sa mga CS nga, most common risk factor is DM, hypertension, obesity, treatment of with corticosteroids and immunosuppression. Okay? Chorioamnionitis, prolonged labor, prolonged rupture of membrane, prolonged operating time, excessive blood loss, abdominal twin delivery. So what are the management saying? Okay? Na-add lang tong semi-fowler's position to promote drainage. Then, ayan. So that's the last part of our postpartum infection. Then, let me look for the so this is the last one. Thromboembolic disorder. Okay? Ano po yung thromboembolic? From the word thromboembolic. Okay? Wait lang guys. So we have thromboembolic disorders. We have the SVD and DVT. Okay? Ito yung mga manas-manas, guys. Pag sinabi nating SBD, ayan, femoral thrombophlebitis or pelvic thrombophlebitis, diba? Ito yung mga signs of mga deep vein thrombosis or DVT. Alam ko deep vein niya. Guys, yan, deep vein thrombosis ang DVT, and then SBD kasi very ano lang yan, bihira lang kasi yan, guys. Small vessel disease. Okay? So ang very common dyan is si DVT, si deep vein yan. Deep vein thrombosis, okay? Or deep vein yeah. Deep vein thrombosis, DVT. Kasi si SVD, small vein disease, madalang kasi ang ano ko dyan. Pero DVT ang very common. So, thrombophlebitis, we have two. So, we have femoral thrombophlebitis, since femoral sa popliteal vein sa may paanan. And then we have pelvic thrombophlebitis, diba? Sa may ating pelvic, sa balakang, ovarian, uterine, hypogastric vein. So, question is phlebitis the same with thrombophlebitis? Okay. Phlebitis means inflammation of the lining of the blood vessel. Okay. Pag sinabi natin phlebitis, namamaga yung lining of blood vessel. So, gaya niyan guys, diba? Tignan nyo tong area na to, diba? Namaga yung inflamed area. So, which means the the blood vessel. Lining of the blood vessel. Okay? So, ayan. Pag sinabi natin thrombophlebitis, inflammation with the formation of blood clots. Kaya nga, from the word thrombo, blood. Okay? Phlebitis is inflammation of the lining of the blood vessel. So, pag haluin lang, inflammation with the formation of blood clots. Okay? So, ito na yun, guys. Diba? Compare nyo tong paa niya here. And then dito, grabe no, grabeng manas. Grabeng maga. Okay? Nag-clot na siya. Parang nag-constrict yung blood vessel. Okay, so, di ba? Nakita yung difference? So, what are the predisposing factors pag gumawa tayo ng CAUSATIVE or etiology? Ayan, nawawala si ma'am. So, the fibrinogen level is still elevated from pregnancy. Dilatation of lower extremity veins is still present. And the relative inactivity of the period or a prolonged time spent in delivery or birthing room stirrups. Diba? Pag nakahang ang paa mo, talagang magmamanas ka dun. Kasi nga, ang sakit-sakit. Diba? Ang tagal-tagal nakataas yung paa mo. Diba? Nakalitotoming position si patient. So, what are the risk factors? Okay, grabe no, pinaparinggan ako. So, don't forget the word OFPO. Mnemonics is OFPO. Obesity, varicose veins, previous thrombophlebitis, older than 30 years old with increased parity, di ba? Then, high familial incidence. So, what are the prevention? Yan, aseptic technique, ambulation limiting the time a woman remains in obese stirrups. Okay? So, kung wala pa talaga, hindi pa manganak si patient, pakibaba mo na yung paa. Then, padded stirrups, support stockings. Di ba, napapansin nyo, may nagsusuot ng medyas, may nag-stockings para po ma-prevent yung thrombophlebitis. And then, not wearing constricting clothing. Wag masikip. Di ba, hindi naman tayo model. Then resting the feet elevated, di ba? Usually na nagka-trend Dellenberg si mother. Kasi nga tinataas din, i-elevate niya din. Para yung blood flow, hindi lang nakaprolong na nasa baba lang. Deambulating daily during pregnancy. So femoral means sa paa ha guys, paa. So what are the assessment? Fever, chills, pain, redness, 10 days after birth. Shiny and white skin, di ba? Parang akala mo hindi nag-lotion, yung pala yung nagkakaroon na ng thrombophlebitis. And then, Positive Homan sign. Okay, may masakit yan guys. In pain si mother. And then increased leg diameter. Diba? Yung isa is payat, yung isa mataba. So what are the management? Bed rest with affected leg, elevated, administer anticoagulant. Since nag-constrict ang bloodstream, nagbibigay ng anticoagulant para or thrombolytic agents para po dilate yung kanyang blood vessel and maganda yung daloy ng kanyang blood. And then apply moist heat. Diba? Warm compress. Then use of bed cradle. Then back, buttocks, and heel care. Massage. Then check for bed wrinkles. Yan. Hindi lang po for thrombophlebitis yung inano ng bed wrinkles, diba? Pati rin sa bed sores. Kung prolong nakahiga. Then administer analgesic sa pain. So, ayan. Anticoagulants, usually we have heparin and comadine. So, ano pong chinecheck sa blood test? Pag magbibigay tayo ng anticoagulants, syempre, the PTT. Okay? Or the PT. Then, pag magbibigay tayo ng heparin through IV. Pero pag comadine or warfarin, pwedeng oral. So, ayan. Pwede din po siyang sub-Q. Okay? So, anong klaseng gamot po yan? Pwedeng protamine sulfate or pwedeng vitamin K for clotting factor. Then, can breastfeed. Pwede tayo mag-breastfeed kung heparin ang binigay. Pero kung nagbigay tayo ng comadine or warfarin, hindi po pwede mag-breastfeed si mother kasi pwede maka-affect sa kanyang baby. So, ayan po yung klase ng ating anticoagulants. Diba? Makulit ng anak ko eh. Yan, thrombolytic agents. We have USA, urokinase, streptokinase, and alteplase. Ayan. So, ganyan yung management na gagawin nyo. So, pelvic. Okay, from the word pelvic sa may, pelvic area, yes. Sa may, ang tawag dito? Balakang. Follows mild endometritis. Risk factors are the same as for femoral thrombophlebitis occurs later than femoral thrombophlebitis 14 or 15th day. So what are the assessments saying? Ayan, pelvic abscess lang nadagdag. So ayan guys. Ito po yung anatomy niya. Okay? So management, total bed rest, administer antibiotics, anticoagulant, and laparotomy. Okay, nag-undergo po siya ng surgery, what we call laparotomy. Okay, so that's the end of our topic. Okay, so we're done with postpartum hemorrhage, puerperal infection, and thromboembolic disorder. So, next we will have our postpartum psychiatric disorder. So, which is yan yung mga postpartum blues, yan, marami tayong ma-encounter. Maganda siya and very exciting. So, doon muna tayo mag-last. So, thank you so much for your time. I hope panoorin nyo to and marami kayong matutunan. So, thank you so much and God bless.